Around the year 2000, there was an estimated 7% of home health patients were living in assisted living facilities. And around 2010, the studies has shown that around 7.5% of home health patients lived at assisted living facilities. So as the years go by, there's going to be a steady growth of patients that can be obtained at these assisted living facilities. So let me go ahead and share with you several tips on how to be able to create relationships with assisted living facilities and keep it legal. Okay, so here we go. Tip number 1. Don't use assisted living facilities, contract therapists, if you have therapists on your staff. Countless times I have seen several facilities require that your home health agency use their in-house therapists, use a therapist that is actually employed by those ALFs. So don't do this, okay? So even if you have your own staff of therapists and you are using their therapists, this can be looked at and considered a violation of the anti-kickback laws. Remember, make sure to use your therapist or your contracted therapist and not theirs. Okay? What you need to do is give them an educational-based marketing if they are preferring that you use their agency. This is always a good time to be able to show them the rules of the anti-kickback rules. It is important that you both don't violate this. Now, let's say, for example, you don't have any staff and you would have to use their contracted therapists. Then it's okay to do it as long as you are paying fair market value. That's, again, fair market value. Okay, so tip number 2, don't give assisted living facilities items of any value or free services in exchange for you or your agency to become that preferred provider agency for that particular facility. Yes, there is chances where people are not educated about the anti-kickback laws, where they may ask you for anything of value in order for you to be placed in that preferred provider status, such as that big lunch or for you to sponsor an event at their facility. Beware, okay, beware, and go ahead and give them some educational items that can explain to them why your company cannot do what they're asking and why they should avoid from doing this and they should not be asking this of others. Your agency should not be placed in the preferred provider list because you are giving them of something of value. You should be in that list because your agency provides great, amazing services and care to the patients of that particular facility and not because you gave them something of value. Tip number 3. Provide educational-based information instead of offering free risk assessments at false safety clinics, or the famous free vital sign checks or free vital signs assessment. By you giving these educational, informational seminars and pamphlets, what you're doing here is you are showing that you have a value. It's doing the same thing. You're accomplishing the same goals of promoting the agency's name